As smoking has decreased, you would expect the number of lung cancer cases to go down as well, but doctors say that's not the case.
In fact, lung cancer cases are rising in non-smokers and women, making lung cancer the leading cancer killer.
ABC 2's Ashley James has one survivor story.
Holly Cole was a competitive ice dancer, an athlete her whole life. She and her husband were national champions in 1996 and have continued on in the sport as judges.
While I was actually judging at the national championships, I got the phone call that said, "You have lung cancer. When you get home, you need to come see us immediately."
Holly was shocked.
I'm in good shape. I'm in good health. I don't smoke. How could this happen to me?
Holly had no symptoms. The nodule was only discovered after a trip to the emergency room 7 years ago, where she had a series of tests for unrelated chest pain.
During that CAT scan, found this little node on my left upper lung, and my doctor said, "It's very tiny. Let's just keep an eye on it."
The nodule was monitored for a few years until her yearly CAT scan showed a change. But Holly was one of the lucky ones. Her lung cancer was caught in the early stages.
And they told me, had I not found out, I probably would have come to them when it was in an advanced stage.
Lung cancer accounts for about 27% of all cancer deaths, and in 1987 surpassed breast cancer to become the leading cause of cancer deaths in women. Many times there are no symptoms.
By the time it's symptomatic, it's fairly well advanced.
Dr. William Krimsky of MedStar Health says there's been a recent push to screen for lung cancer for those in high-risk groups, like smokers, but that still wouldn't have helped other women like Holly.
I think overall we believe that some form of screening is a good thing, but keep in mind, again, those are in high-risk groups. What we just talked about is the idea that, in fact, more women who don't smoke are getting lung cancer.
Dr. Krimsky says there are other steps we can take, including lung health prevention. There are also advances in technology. Here's the Electromagnetic Navigation Bronchoscopy, a GPS technology providing a roadmap to the tumor. This was used on Holly.
And it allows us to navigate this catheter, to a variety of different places in the chest. So keep in mind, we're searching for the needle in the haystack.
While the technology is about 10 years old, there are improvements in development that could begin clinical trials in a few months at MedStar Franklin Square. As for Holly, she underwent surgery and life has returned to normal.
They removed my upper left lung lobe. Apparently you can live with only a lung and a quarter. So that's me.
Staying positive, she says while she gets out of breath a little easier than before, she's able to stay active and has this advice for other women.
I would say listen to your body and seek out the medical help. You're your own best advocate.
For ABC 2 News, I'm Ashley James.